I went to University of Iowa in Iowa City, a Big Ten school. Grew up in Illinois, but I had a couple friends that had gone there. And when we were doing our visits to campuses, fell in love with the place. My main draw for that is I knew that they had pretty much every post-grad program available, so I was able to kind of explore and decide what I wanted to do. They also are well renowned for their dental school there, and one of the nicest things about the dental school there is a lot of the farmers, it's a seasonal activity, so there was never a shortage of patients. It made it easier to get requirements done. After 3 years, I was lucky enough to be accepted into dental school and took the DAT exam and so on, and decided in my selection process that I would remain at University of Iowa for dental school. Excellent experience. I already knew the campus well, had a lot of support system there, so on and so forth. The dental school was fantastic. It was small town feel, University of Iowa, and a lot of very nice people in the state of Iowa. So conscientious patients, the instructors were great. They were all there for the right reasons, not for their personal gain, but to help the students learn, which is what we were there for, of course. I would say that the system was set up for us to succeed. Dental school is difficult. However, they were truly concerned about, did you get it, did you learn, versus just trying to pound you through the system. So after dental school then, because I had gone into dental school after the 3 years, I figured I had an extra year to play with. And I wanted to gain more experience so that when I came out into private practice in the real world that I was ready to go. And so I went through what's called general practice residency. It's a hospital-based program, and you are resident in the hospital. I went to Loyola University, it's Foster McGaw Hospital in Maywood, Illinois. Heavy trauma center, it's a class 1 trauma center, and lots of cases that we would never see here. So for instance, pathology or trauma that in dental school you learn about in the book, this is what is out there, you'll never see this in the real world. Well, guess what? You don't see it in the real world because you see all those at the hospital in your residency. A great year. Learned how to communicate with other physicians, referring dentists, really learned the importance of dentistry and the overall health of your patients. So it's not just teeth, you're taking care of the person. You happen to be doing the dental component of that. But I realized how much respect the dentist has from the physician in the community, which maybe I didn't realize that part before.